Hello, my name is Janine Yanish, and I am the Executive Director for the Health Alliance for the Uninsured. Our mission is to be a catalyst for improved health care for those who otherwise would be unable to obtain them. And we do this through partnerships with our free and charitable clinics, including a couple federally qualified health centers, and also with our partnerships with the hospital systems, with the United Way, with volunteer physicians who are willing to donate their time, expertise, even sometimes their facilities for us to connect patients who are needing a higher level of specialty care, and this is a life-saving opportunity for them.
My name is Stanley Hupfeld, and from 1987 to 2010, I was the Chief Executive Officer of Integris Health. Dr. Murali Krishna, who is also a medical staff member and administrative staff member of our team, came to me and told me about all of the free clinics operated in the general Oklahoma City area. And he had this idea that if we combine the resources of those clinics, we could do even more good. They had a system at that time, since all these clinics were separately operated. They all used what we came to call as, will your brother-in-law help us? So a patient would come to a clinic, they'd need something more serious than the clinic could provide. Perhaps they were diabetic and need their foot amputated, or they needed other surgical or medical interventions. And the clinic would then go about trying to find a physician that would take care of that patient for free. And what that resulted in is each of the clinics, in many cases, were calling the same doctor's office, asking questions for different patients. And Dr. Krishna's idea was that if we combined all those efforts, we could get more physicians to volunteer, more hospitals to volunteer, and it would be a much smoother system.
Hello, I'm Mark Youngblood. I'm the Executive Director of the Crossings Community Clinic at 10255 North Pennsylvania Avenue in Oklahoma City, Oklahoma. And it's a thrill to be able to speak to the HAU audience and let you know just what a great benefit our partnership is. We wouldn't be able to do what we do, certainly at the level that we do it, without the help of HAU. We're amazingly equipped to be able to provide services for those who are uninsured and low income in the Oklahoma City area with the services that we have under our roof. But there are things that we can't do. There are providers that we don't have. There are specialties that we don't offer. And when we get to those situations, we count it such a privilege to be able to network with HAU and use those specialty providers to be able to deliver the services that our patients need. And so we wouldn't be able to do it without them, and we're just thrilled to have that partnership.
I'm Beverly Cavanis. I am a radiologic technologist. I'm also a registered nurse, bachelor's degree registered nurse. I've been with the Health Alliance for 12 and a half years now. I am the Director of Patient Services. Rather than kind of bore you with all the statistics, I thought I would tell you a patient story. And this just kind of shows the way that the Care Connection work. I do work with 2 bilingual referral coordinators, and they make a huge difference because about 50% of our patients are Spanish speaking. So I have a patient that started off getting a test to check to see if he had blood in his colon, and as it turned out he did. We were able to send this patient to a gastroenterologist so that he could have a colonoscopy done to check to see if there's any other problems. Well, he had that done, and it turned out that he had colon cancer. Well, we were lucky enough that we have a colorectal surgeon. He was glad to take our patient, and so the patient's surgery was done, but then he needed follow-up with an oncologist, a radiation oncologist, and a oncologist for chemotherapy. And so we were able to make that connection as well. In the meantime, the patient had to have a lot of scans done to check to see if there were any other tumors growing. We were able to do that because of our resources. And in the end, this patient finally went a year and was able to have what we call a takedown, a colon takedown, and so that's where they reattach their colon together. And so his life is different in so many ways, but he is back to basically normal. He's able to work. He's able to do things that you and I would be able to do. And that's just kind of the way that our system works. There are things that are connected together, and it is done through this office for our patients at our partner clinics.
At Ministries of Jesus, we're tasked with caring for the whole person's health. And in the medical clinic, we see many different needs. Some of the needs we are not able to meet without outside help. And Health Alliance for the Uninsured provides support with getting a patient to a diagnosis through providing ultrasounds and x-rays for our patients. And then second, they have a large referral network that we are able to refer to. For example, in 2019, we saw a gentleman who presented with bilateral hip pain. He was not able to work as a bricklayer. It was deemed he would need to see an orthopedic doctor, and Health Alliance for the Uninsured connected this gentleman with Dr. Charles Bryant at Integris. Dr. Bryant evaluated this patient and scheduled him for a left hip replacement, total hip replacement. That was done in January 2019. And then in March of 2019, he had his right hip replaced. And this gentleman just came back to see one of our primary care providers at Ministries of Jesus in January of 2020, and he is doing very well. He is pain-free, he's walking very well. Seeing his ability to now return to work, enjoy pain-free walking, and recovering so well from his hip replacements is incredible.
I'm Vera Parrish. I'm a registered nurse, and I'm the clinic director at Crossing Crown Clinic here in Oklahoma City. We've been working with the Health Alliance since it started, but as we've grown, Health Alliance has provided the patient assistance program where they are able to file for our patient assistance medications. And without them, I don't think it'd be possible for us to do what we do.
It's very rewarding to be able to help a patient get life-changing medication for a patient that hasn't had a constant supply of insulin and hasn't really been having a very good quality of life, having trouble holding down a job, to now have a constant supply of insulin, to be able to work, to be able to live their lives the way they would desire to. It's also rewarding to be able to see the changes in these Hep C patients that really thought they had a death sentence, unable to afford medication that's $1,500 a tablet, now has the medication, goes through the treatment, and it is cured, and what a change it makes in their life. It's very rewarding.
The Health Alliance for the Uninsured last year provided more than $3.5 million of prescription assistance to free and charitable clinics and vulnerable Oklahomans in central Oklahoma. Our Care Connection program provided more than $5 million of donated specialty services, including surgeries and MRI scans, colonoscopies, and more. The Health Alliance for the Uninsured thanks you for being a part of the solution. Thank you for caring for Oklahomans and the health of our community. Without a healthy community, we don't have a healthy state, and without a healthy state, we don't have the quality of life that we all treasure and value. Thank you for your financial commitment. Thank you to the physicians that are willing to donate their time and expertise to us. If you're interested in any more information, you're welcome to visit our website at HAU Online, and we just thank you for all that you do.